Well, hi everyone. Thanks so much for being with us. We love seeing you here with us on a Tuesday at this time. And my name is Jules. I'm a presidential director with this amazing company, LifeWave, which I am completely in love with on every level, and especially with all the people. The people here are amazing. So this is how it's going to go for the first half an hour. We're going to go through some science and technology of what these patches are, why they work, why they're so profound in the future of holistic medicine. And then we'll hear from a few people some stories of what's happened for them so that you can hear, that it's not just you that has had an amazing response, but everybody else. And then we'll have time for some Q&A. So feel free to put your questions in the chat or raise your hand at that point, and then we'll go from there. So I'm going to introduce my wonderful sponsor, Dr. Staci Holweger. Dr. Holweger, she is an SPD elite in this business. That's the very, very top of this business. So she's highly successful. She has 2 PhDs in integrative medicine and functional medicine. So she's as smart as a whip. So you can ask her any question. She's amazing. But the best thing about her is she has a heart of gold, absolutely a heart of gold. I love her dearly, and I'm really happy that she is my sponsor. So thank you, Dr. Staci, for being with us. I know you just got back from London. Appreciate you so much, and take it away.
Absolutely. Thank you, Jules. Happy to be here. So I want to tell you a little bit about this technology and how it works and how it can help you or people that you care about. So if you've got a notepad, pen, or pencil, grab that. Might want to take some notes, jot some things down. And of course, like Jules said, if you have questions, I'll be happy to answer after we hear from some success stories. So this is what our patch looks like. This is a non-transdermal patch. Even though it's sticky on one side and smooth on the other, when I put this on my body, there's nothing that's entering into my body. Nothing is transferring in. No medicine, no chemical, no herb, no nutrient. This is actually a wearable light technology. I know you didn't see beams of light shooting from my chest when I put this on. I'll do it again just in case you weren't watching. This is what it looks like. No beams of light. This is just a wavelength of light that enters the body that you don't see or feel. So when I get up in the morning, I put this patch on. This is X39. This patch is going to elevate a peptide in my body with a wavelength of light. Now, I know you're familiar with light therapy, red light therapy devices, lasers, maybe infrared saunas, or of course, the sun. We know the sun, right? That's a form of light therapy. Actually, the oldest form of light therapy. Since the dawn of time, people have been using light to heal, right? We know that wavelengths of light that enter your body, you don't see or feel them, but they create change. So similar to the sun or red light therapy devices or lasers, our wearable light technology have wavelengths of light that enter the body that we don't see or feel, but they create change. So let's talk about the change that has created when we put X39 on our body in the morning when we get up. Immediately, that wavelength of light enters and it elevates a peptide in my body. Now, peptides are becoming all the rave. It's interesting because David has been using wavelengths of light to elevate peptides in the body for almost 20 years. But it's just starting to catch on right now. So when I tell you that our inventor of our technology is light years ahead of the game, that is absolutely true. David Schmidt invented this patch. He's invented almost a dozen patches over the last 20 plus years. And so when you put this on, it elevates one peptide, GHKCU copper peptide. Now, for time purposes, I'm not going to get into all the benefits of GHK. You can go to PubMed, type in GHKCU. You'll find 13 pages of benefits from elevating GHK in the blood. So we're going to elevate GHK. One of the main things that we're going to talk about is the fact that it upregulates or resets over 4,000 genes back to their young, healthy state. And it starts the process of activating and mobilizing and elevating your own stem cells. So GHKCU copper peptide is what we call the fountain of youth. It is definitely a reverse aging peptide. It's one that declines as you age. And we know stem cells are the holy grail of healing. And we know stem cells are abundant in your body when you're younger, and they decline as you age. So by the time you're in your 60s, you have less than 10% of your stem cells and probably around that same amount of GHK, copper peptide, active in your blood. So hence the degeneration or aging process. So what happens is we elevate GHK, we activate stem cells, our body then goes to work, our own stem cells go to work to repair and regenerate whatever's needed in the body over time. And so when I say starts the process, like I said, it takes time for these things to become dormant. And so it takes a little bit of time to get things moving and mobile again. So this technology is to be worn in the morning when you get up. You leave it on for 12 hours and then you take it off and you throw it away. Or you can put it on your pet, of course. And you get up the next morning, you put on a brand new patch, you leave it on 12 hours, day after day, week after week, month after month, or even like some of us on here, you know, we've been patching for years, 4.5 years for Laura and I. So what's the reason for patching every day for 12 hours on a consistent basis? Well, when you elevate peptides, peptides compound over time. They need consistency in you wearing them, wearing the patch, elevating the peptide, and then that 12-hour break off. You get up the next morning, they need to be activated again. So that consistency, they compound, meaning they're going to have exponential benefits the longer that you patch. And of course, those dormant stem cells, you know, it took, 50, 60 years for them to become dormant. Don't worry, it won't take that long for them all to wake up. But we do want to give it at least a month for every decade you are old to wake up your dormant stem cells. So if you're in your 40s, 4 months, 50s, 5 months, 60s, 6 months, 70s, 7 months, and on. Why does it take time? Well, because again, they're dormant, right? And so we have to wake them up. We're going to reset them with the patch. It all happens literally a split second, speed of light. You don't even feel it. And your stem cells then are like, oh, hey, yeah, let me get moving again. Let me do what I did in this body when I was younger. And your stem cells are smart. You're smart. Your body's smart. It's intuitive. And so your stem cells will go to the areas that are needed in your body first. So you may say, I think I want to use this patch. I've got some issues with my knees. I'm trying to avoid a knee surgery. But your stem cells say, hey, lady, we got to fix that heart first, okay? We've got some heart issues going on. So let's go there first, and we'll address your knees in a little bit. You'll be fine. And so you can't direct where your stem cells go. So you have to be patient with the process, knowing that you'll have results along the way. So what do people notice? Well, the first 3 to 6 weeks, based on clinical studies. Now, of course, we have people that are one-patch wonders. They feel things right away within the first day or 2 or week. But based on clinical studies, in the first 3 to 6 weeks, people start to notice better quality of sleep. They start to notice less pain in their body. They notice they have more mental energy and focus and clarity and concentration. And they notice they have faster recovery from activity or fitness, more physical energy. And they notice a faster healing in their body if they do have an injury or an accident or some type of wound. And so we can see those things in the first 3 to 6 weeks. After that, though, honestly, that's where we start to see things compounding. And we see some pretty amazing results. When we look at cardiovascular function, when we look at neurological function, you can see changes in the brain and in the heart in as early as 6 weeks. And then again, looking at organ function, looking at your kidneys, your liver, your lungs, your pancreas, we see those changes over months, right? Over time period. Like for example, when someone gets their blood work done and then they start patching and they go back again 6 months later and it's like, oh, whoa, hey, things are changed. Your kidney numbers look better, or your liver enzymes look better. Or wow, I don't think we need to have you on this much blood pressure medication. You're hanging on your own. Or gosh, your cholesterol's went down. Or Wow, what happened to your thyroid numbers? Things are changing with those. And we need to reduce your medication, but that doesn't happen overnight. And it surely does not happen in the first few days or even weeks. That's happening over time because you're patching consistently. So, a couple real quick questions people always say is, will it work for, and they list their disease, their condition, their issue. And the answer from A to Z is yes, 100%. You don't need to ask me about what about this disease or what about this condition or what about this symptom, even though you can. The answer is going to be yes. The patch will 100% work for that. How do we know? Because it's your body. Your body knows how to heal itself. We've just got to activate its stem cells again. The stem cells are going to do the work. The patch isn't doing it. It's just asking it to do what it did when it was younger, which was perform perfectly. So the answer is yes. For everything above the sun, the answer is yes. We are not doctors here to diagnose or treat or make any claims to cure people, but the answer is yeah. Just give it some time. You'll get there. And that's the second question people have is, how long is it going to take for I'm going to notice results? No clue. Don't know. Give it time. Give your body the time. It will prioritize what needs to happen first in that order. We can't force our stem cells to go to our shoulder by putting the patch on the shoulder. Can't force them to go to the knee by putting the patch on the knee. Your stem cells are systemic, which means throughout the whole body, and they will go wherever they need in the order they decide. So, even though we think we're smart and we may be in charge of our bodies, we have to be patient with the process. So, and we're all so different. We're all so different. You could have two people that have the same diagnosis, but yet have completely different results in how fast their body responds to the patch because it's, again, individualized. The last question people always ask me is, where do I place the patch for? And then they'll give me their symptom or disease or condition. Now, if it's pain, I'll tell you, put on the LifeWave. It's a patch that David invented to get rid of pain on the spot. Doesn't get to the root of the problem, but of course, yeah, put the LifeWave on the location, 100%. But otherwise, there's no set location to patch for any certain disease. You can't put a patch on your eyeball to fix your eyesight. But yet we have people reduce their prescriptions every single year when they go back to get their vision tested. Same thing with people with diverticulitis, diverticulosis, right? Your intestines are the size of a tennis court. Like you can't put a patch on one spot in your intestine that's all wound up in there, and yet your diverticulosis just seems to disappear. So have to keep in mind that there's no placement per disease. The key is that it does not work if you leave it in the package. So this package, if it's sitting in here, it's not going to work. But if you take it out every day and you put it on your body, then it's going to work. But you got to take it off after 12 hours or otherwise you turn into a pumpkin. Just joking. Otherwise, nothing happens. You just forget. And then you, the next morning, get up and you take it off. And then you don't patch that day. And then you patch again the next day. We want to keep it consistent with 12 hours on, 12 hours off. So with that being said, Jules, I'm going to turn it over to you. And I'm going to let you have the two people that want to share their personal testimonials, or three, however many you have, before we do a little Q&A. So if you have questions, because you've been writing notes, I've seen you just fervently writing notes there. If you have questions, then you can type them in the chat or you can ask after we're done hearing our testimonials.
Yes, fabulous. Thank you so much. Well, so there are a lot of people that don't have their videos on, so I'm not sure whether to ask them. So if you would like me to ask you, please put your video on so I know it's cool to do that. But I'm going to ask Val. Val, you had some amazing things happen with your foot and other things. So would you share, please?
I'd be happy to. And I've realised that I hadn't got ahead of the game by putting a picture in the chat, but I will do that. That was just, you'll see in a moment when I can do that, there was a disjointed bone in my foot, which, and my toes were sort of a bit gnarled and they straightened out. And just briefly, my thyroid, which has been a problem ever since a doctor decided to do well woman checks, I don't know, 15, 20 years ago. Seek and you shall find, and my thyroid was apparently off, but I, carried on trying to get it down. And within a couple of months of patching, it's the first time that it's normal. Well, it was always been reasonably normal for me, but it's keeping those that want me to do other things at bay without me having to explain myself.
I love that, Val. And you know, I talked to someone yesterday who's been suffering with allergies, and I talked about you, you know, where you know the allergy hay fever thing just disappeared, and I said it disappeared for me too, and I said it's going to disappear for you too, to my friends. So thank you for that other story as well. Thank you. I'm going to pop over to Deborah Mendes. Would you share your any of your stories? I know you've had many things happen.
Yeah. Well, I'm just going to show you my hair. If you can see it, this is like 18 months in doing the X39, the Eon, the Carnosine, the Alavida, I think made a big difference. So I'm not sure if you can see it, but it is really good condition. It's shiny and much more volume. And when I've been doing all these in-person events, and including a hairdresser, and I've been showing people, they were going, oh, wow, amazing. And it's long. So I'm very happy about that. And the point is, if it's external, it's there's something going on inside as well. But yeah, the first thing I noticed was that the brain, you know, the faster processing speed and the focus. And you know me, I was quite anxious beforehand, so my nervous system really settled and I had much more brain coherence. So that was brilliant, because I had so much overwhelm when things came into my inbox that I was irritable and cross all the time. So that really helped me. And a little, quite soon after, about a month, I had a little fatty spot underneath my eye that just disappeared really quickly. And yeah, apparently that was something to do with one of my organs inside. So that had been there for 2 years. So I was really happy about that. Yeah, just so many things. Yeah, my nephew and niece noticed I was even more cheerful and more calm the second Christmas I was with them. Just vitality and, you know, all the things, just feeling so much more clear and yeah, together, and more present, I would say, are the main things. Yeah.
Thank you so much, Deborah. And I do recall that. And the level of anxiety just dropped so quickly for you, and your focus and alignment. It was just extraordinary to witness that, you know, beautiful. Thank you. Thank you. I'm going to pop over to Sophia. Sophia, would you share that story with maybe your husband or you, whatever you'd like? Thank you.
I do have a story to share, but I also have a question. So which one should I do?
I would like stories right now, questions later. Thank you.
My husband, he's we were told by the doctor that his condition wasn't going to get any better, but he had a CT scan about 2 weeks ago, and his lung has improved. So that's huge. And I'm much better now. I'm not crying. Because I always cry whenever I had to talk about this stuff, because I get very emotional.
Yes.
But yeah.
He's had an extraordinary recovery, hasn't he? He got in a good place when you started.
Yes. So that is my story.
Thank you, Sophia.
I think for us it's huge.
Absolutely huge.
So I just know that he's going to get better and better and better.
Absolutely. Thank you so much for sharing. I'm going to just nip very quickly over to Pat. Pat, you have some wonderful stories. Would you share one or two?
I'll just give you the most recent, which is really cool. My son, who is in his 40s, when he started on the patches, he kept saying, I don't feel anything. I don't think anything's working. And I said, just hang in there. Just keep using them. It's going, you know, on the inside where you may not know what it's working on. So recently, and he's been patching probably maybe about a year and a half, because he started about the same time I did. And he said his doctor ran his blood tests for thyroid and all of his tests throughout his whole body. He does a whole panel. But the doctor said, wow, your thyroid is looking great. We need to probably reduce the med. And then the doctor said, you've never had a blood test this great before. So they were really impressed of how it's really improving. So that's really pretty exciting and pretty special. So
Pat, how old is your son?
49.
All right. Thank you so much. It's just lovely to be able to help our kids. I absolutely love that. Love that so much. Thank you. All right. Well, it's time for some questions. So please don't be shy. Put up your hand or put it in the chat. And then after the half an hour point, you're welcome to stay or welcome to go. We're going to carry on after that with some other things. But who's got a question?
Thank you, Jules. Thank you. I know Sophia does, but I just want to say first, Pat, that's interesting for someone that says, I'm not feeling anything. I don't notice anything. Nothing's changing. Like, do you really feel, your thyroid changing? Do you feel your kidneys changing? Do you feel your liver changing? It's kind of like, do you feel them going bad? Like, I may not feel my best or my optimal, but we kind of chalk that up to aging, right? It's just part of aging. So I love that, especially with men. No offense, men.
Oh, and by the way, Dr. Staci, 4 months into it, because he has gray hair from his 30s because of thyroid, he said, oh my gosh, after about 4 months, he said, my hair color's coming back. So that was shocking. But this recent one was huge.
Yeah.
So thanks. Sorry to interrupt you.
No, you're good.
Forgot to add that.
I just love it though. 18 months, and they want to know what patches he's using.
Oh, he at least X39 and Eon. He first started patching with about six or seven patches, and he couldn't remember to take them off. So I said, just do X39 and Eon, but he does use X49 occasionally. So he shifts. He had COVID and he was on glutathione, Eon, X39, X49, and that cleared up quickly, like within days, 3 or 4 days. So I do encourage him just those two main ones because of his busy schedule, keeping track of taking them on and off.
Awesome.
So,
Thank you.
Yeah, thanks.
So Deborah wants to know what patches for calcification of breast tissue. So remember, we have no diseases or any kind of conditions that we have clinical studies on. We just don't. We don't look at any of that. So I can't say, oh, this patch is going to get rid of calcification of breast tissue. There's no way, right? So knowing what you know about X39, you would obviously make that the first patch that anyone would use. And then knowing what you know about Eon, if you know anything about Eon, that's a patch that reduces inflammation in the body. Anytime you have any diagnosis, you have inflammation somewhere that's causing this, right? So that would be your easy first two patches that you would put anyone on are X39 and Eon. But just keep in mind, we don't have patches for conditions. Like if someone says, what patch do I use for Alzheimer's and where do I put the patch for Alzheimer's? I can tell you what patches we have great studies on for brain function, but we don't have any studies on Alzheimer's. Just like we don't have studies on diabetes and any of the diseases. Okay. All right, so I have a brand partner whose wife is a physiotherapist. He's trying to persuade her to at least use LifeWave on clients that are in too much pain for her to work on them, but she's concerned about staying within her field and staying compliant. So, obviously we can't tell someone, yes, use this, you have to do this. Who knows what type of facility she's working in. It may be that they don't allow her to do that. If they do allow her to do that, and they don't care if she's using like the KT tape or maybe, some biofreeze or other types of things with her clients, then the patches would be no different than using any other type of tool with her client. If that's a situation and she doesn't have any problem doing that, then she's perfectly fine. The LifeWave is just a tool to help, just like the biofreeze, that roll-on stuff, or the KT tape, or even an ACE bandage. Those are tools that therapists use. Sunny, oh, you got your patches now. Wow, that was fast. Awesome. So with the X39, yes, during the day, and then you would use the Alavita at night. Yes, you can definitely start with both of those, at different times on day one. So tonight you could throw on your Alavita, and then tomorrow morning when you get up, you could put on your X39. Just make sure you give the Alavita full 12 hours. You can put on your X39 as soon as you wake up, but every patch has its own 12-hour window. Sophia, I know you had a question. Do you want to ask that now?
Yes, please. I'm embarrassed to ask even because I know you addressed this like 6 months ago or longer, but what kind of patches can somebody use except the F39, right? That had a transplant organ.
So with transplants, we can't make any recommendations on any patches.
Oh, okay.
Okay. They need to go to their doctor. They need, even though the patches are non-transdermal,
right,
not put anything in the body. Someone that's had a transplant of an organ that's not theirs, they weren't born with it, they're on many immunosuppressant drugs. So they need to have the conversation, hey, this patch elevates glutathione, hey, this one reduces inflammation, this elevates carnosine, or this, energy enhancer, IceWave. The doctor would need to understand the processes of the patch and then make that decision. We would never say, oh,
okay,
you're good to use any patch. Hopefully your heart stays and it works fine. But if it doesn't, whoopsie, like we couldn't do that.
Thank you, Dr. Stacy, so much. Appreciate it.
Sunny, you can start with the Alavita or the Eon tomorrow morning. If you want to put on Eon tomorrow morning, do your X39 Eon during the day and then do your Alavita at night. Definitely. Yay! Shalina got her patches too. Gosh, that was fast. Didn't you guys just order on Saturday? Dang. Way to go, Galway, Ireland. Talk about serious fast shipping. Hello. Gosh, that's incredible. Yay. All right. Any other questions? What patches we suggest for menopause? So obviously you're looking at those symptoms of menopause. You would obviously use your X39, your Eon, right? Definitely look at Alavita. Alavita is a fantastic patch for female reproductive organs. So that would be your nighttime patch. And depending on what other symptoms they might have, everybody's different with that. Maybe SP6 might help them a little bit with hormone balancing. We've seen both, sides of that with different, menopause is there's no cookie cutter of that, right? With what some people don't even have any symptoms. And some are like quick, and then others, they deal with stuff for years. So those would be the ones that you would potentially look at for sure. All right. Any last questions before we wrap it up for today? All right. Well, thank you, those of you that were guests, and for those of you that are first-time brand partners being on here. We appreciate you taking the time. If you are a guest, get back with the person that invited you. They're going to be able to talk to you a little bit more about the patches. They can share some videos or some studies if you're interested, or even PDFs on how the different patches can benefit different things. We have a sheet that'll share that information with you guys, so you can kind of see which ones are going to benefit which organs. So think in terms of my heart, or my liver, my lungs, my brain, or the systems in the body, right? The endocrine system, the digestive system, the immune system, and they can be able to help guide you in that direction. And then, of course, be able to help share with you how we have wholesale pricing for anyone to be able to purchase the product at the discount shipped to you lightning fast.